Have you had a C-section, a tummy tuck, myomectomy, hysterectomy, a gastric sleeve, bariatric surgery, any form of abdominal surgery? Stop, share this with those who you know have, and make sure you stay locked in. Did you know that if you have had any of these surgeries or any abdominal surgery, you face a long-term risk that is too often actually not talked about until it's generally too late? Having dealt with these complications personally, this conversation is very important to me, and so much so that I have to dive into it. Tonight I'm bringing on a friend of mine, board certified gastroenterologist, to talk about it. So let's get into it. First, as always, I want to welcome you to DETOX Living, where we bring you tips, truths, and testimonies to power your toxic-free living. I am your host, Coach Jessie. I am a fibroid survivor turned health activist and founder of the Detox Now, a holistic health provider of education and supplements that help combat the health disparities that lead to chronic disease, obesity, reproductive health issues, lower life expectancy rates, and more. So tonight we are diving into the topic, let me get it right, scar tissue and small bowel obstructions. And here to help unpack this issue with me, I had to go really high up. It is known as Dr. Gut Happiness, okay? So he's a GI guru, board certified gastroenterologist, Dr. Rajiv Sharma. So I'm going to have him join us. Please stop right now, whatever you're doing, share this request. You love are going to be informed, and don't go anywhere. Dr. Raj, I see you.
Hi there. My face looks fine,
Hi.
right?
Excellent. Let me hear if I can hear you. Can you hear me okay?
Yes, I can hear you well.
Excellent. Excellent. Okay. So, Dr. Raj, I reached out to you because, well, first of all, I don't want to assume. Start by telling everybody, what is a gastroenterologist, and, how did you get to do this work?
Great. Sure. Well, thank you again, Jesse. I was looking forward to this conversation all day.
Wait, stop for a moment and tilt your camera down just a little bit, because I want to make sure they see you in fullness. They don't. There we go. Let them know you got a neck.
I have a neck.
You have a
A
neck.
thick one, too, and I got nice hair.
Yes, you have a great head of hair.
Thank you. I got to thank my dad for that.
Hey. So go ahead, gastroenterologist.
Right. Yes. So, a gastroenterologist is a physician who specializes in diseases of the GI system or the gastrointestinal system.
Okay.
That includes esophagus, stomach, colon, small bowel, liver, pancreas, spleen, as well as immune system around the gut, plus nutrition, which is very critical. So that's what the GI doctors do. And we also study the effect of surgeries, effect of food on the GI system. And now a rising field of GI is GI immunology, means how does the immune system and the GI system, they interact. This also includes a subdivision of the gut flora, right? We all hear about, you get gut flora, probiotics, and this and that. So there's a new division, and that's called fecal transplant, where we are looking at how does fecal transplant affect the body, but also how do the microbes play a role in the health. So that's a rising field as well. So most GI doctors who are well trained, they delve into all these things.
So everything from here, from the neck down to the poop, that's the GI. Okay?
Absolutely. Absolutely.
So how long have you been in this field? And again, tell us, how did you get into this field?
Sure. Okay.
I just want them to know who they're talking to.
Absolutely. No, I will give you my history. So I was born in India, in Punjab, and I went to medical school when I was 18. So I finished my 5.5 years. 18, yes.
That means you were skipped a few times.
Yeah. I just couldn't wait. I'm like, I want to be a doctor. I want to look inside guts
You
all
were
day.
racing your way there.
Yes. So so at 18, I went to med school and trained in India. Then I came to the U.S. I did more training in California at Loma Linda University, pursued my internal medicine degree there, and also did research in GI, in liver diseases, cirrhosis, hepatitis C. And then I went to New York and I pursued 3 more years of advanced training in GI, or gastrointestinal tract. And that's where I learned about Crohn's disease, colitis, adhesions, small bowel obstruction, and everything which is gut and affects the gut and the liver. And after that, I've been practicing for almost 11 years now. So
Awesome.
Combined, I want to say, I got some gray hair, so, I have some balance scars. I've been dealing with the gut and the human body for 20 plus years. Plus, being from India, I have a very balanced approach to everything in life, not just health, but also mind, body, soul too. So I bring the balance of East and the West.
The West.
Yes, and that's the best.
I love that. East and the West.
Yes. I always believe, just like what you do, and you do such a good job in your education sessions and what you're doing, I'm very, very impressed by what you've done.
Thank you.
I feel when we bring a balance of thought processes and balance of different ways of thinking and approaching the same problem, it's much better for everybody involved.
Yeah.
And it's better for the patients and the people who are suffering. Because when you're suffering, you want to get an approach which is balanced. And everybody's different, right? I'm different, you're different, everybody's different. Our bodies will respond differently to different medications, and we have different diseases. So that's why for everybody, there should be a personalized approach.
Right. Not a cookie cutter. You have to look at each person and what the factors are, and you have to listen to them to do that.
Absolutely. It's all, that's why God gave us 2 ears. We got to listen more.
So, for me, I reached out to you because this Lisa Marie Presley cause of death that was revealed recently, which was small bowel obstruction, it was very, very triggering for me. You know that from my personal history includes 5 small bowel obstructions and surgeries to resect, which means cut out damaged, obstructed part of the small intestine, as well as repair damaged parts. And that in the many years of surgery, we're talking about, I've had 15 surgeries altogether, but out of the fibroid surgeries I've had surgeries for complications from the fibroid surgeries, which were small bowel obstructions, where I have less than 3 feet, 100 centimeters, less than 3 feet of small intestine left, right? And I posted about it, and I shared with you what I posted because for me, it was like, this is very important. This is so important, and nobody's talking about it. So I shared in the post what scar tissue is, because a lot of people think it is, oh, look, my scar is healed really well, so that means everything is good. It looks good on the outside, right? The second thing I shared about is that anyone who's had any kind of abdominal surgery is at risk for small bowel obstruction for the rest of their life, right? Now, I'm not a doctor. I am a health activist. I'm a patient advocate. And I am a patient first who's gone through this and has had to learn. And because of that, I am an activist and I'm a health coach. But I wanted them to hear your insight on what I shared specifically in those 2 areas as a medical doctor.
Absolutely. And, you bring up a great point. A lot of people don't talk about adhesions or small bowel obstruction after surgery. And even in the medical community, when we give people consent, we give them the acute issues, like things may go wrong during the procedure and things like that. But we don't really discuss the long-term complications. A lot of times, we do, but it's just not open.
Surface.
That is correct. Because, yes, we are so focused on fixing the issue. But this is such an important issue because millions of people, millions and millions of people who have surgery, they have adhesions, which is scar tissue, and that is causing bowel obstructions.
So what is scar tissue? Let's break it down. You tell them what I told them what I learned. I know, but what is scar tissue?
Absolutely, absolutely. So scar tissue occurs when there's an incision or injury to the body. More specifically, let's focus on internal, right? When say you went to a surgeon, and I work with surgeons all day, just so you know. I work with surgical oncology doctors, thoracic surgeons. We all work as one team, so we all think alike. So this is what we do all day. So coming back to adhesions or scar tissue occurs when there's injury to the body, and that could be trauma, which is say stab or bullet wounds, or incisions, that's trauma. Or if there's inflammation like Crohn's disease or colitis or endometriosis, all those things can do that too. In scar tissue, there is a proliferation of a type of cell, and it's called a fibroblast. A fibroblast is a small cell that creates collagen. As you know, our skin is made of collagen, right? So this is different. This is a different type of collagen, and the one in the scar tissue is different. The scar tissue is more thicker. It's like a rope, and
very dense.
Very dense, very thick. And when you see pictures of the scar tissue, it just looks like almost like a Halloween haunted house. The thick cords coming out.
It looks like spider webs. Looks like spider webs.
Yes, it is a spider. It's crisscross, and that's the reason the small bowel gets stuck in it, because small bowel is about 15, 20 feet long, and it's actively moving around inside the body. So when there's a mesh of scar tissue, the poor small bowel just goes in like a little mouse, and it gets stuck in this trap, and it cannot come back. And because of that, there is a mechanical squeeze of the gut, aka strangulation, that causes lack of blood supply, that causes pain, nausea, vomiting, discomfort. And a lot of times people say, you know what, maybe it's just IBS or constipation. It's not on top of people's mind, but you're doing such a good job on education of the community. It is surgery, any surgery, doesn't matter, even minor, any surgery on your abdomen or pelvic surgery, like C-sections and all.
And hysterectomy is like the second most occurring surgery of all, like across men, women, everything.
100%.
So you're talking about that gastric surgery, tummy tucks, cosmetic surgeries, all of those surgeries are covered, ladies. Because people keep asking, is it a C-section? How about this? How about a gastric sleeve? How about this? How about that? All of them. Say it again, doctor. Say it again.
Absolutely. Anytime you have any surgery on your abdomen, could be minor, could be weight loss surgery, Roux-en-Y, hysterectomy, C-sections. Once an instrument enters your abdomen and your pelvis, you are at risk of adhesions. And adhesions, they continue with time. They present over long time, long when you forgot about it. You got your tummy tuck, you went to Bahamas, you got drunk, and you're like, okay, what's going on? I'm happy. 5, 6, 10, 20, 30 years later, one day you have pain, and voila, you have small bowel obstruction. So that's the reason, because once there's injury to the body, the scar tissue continues to proliferate, because these cells have memory.
What is proliferate? Wait. Look, we got to make sure, because when you're saying proliferate, I got to break it down for our people here. That means growth.
Correct.
Replication.
Correct.
Proliferation means growth and replication. So like you said, 5, 10 years. My godmother, 5 years after she had a C-section, she had an emergency small bowel surgery because it wrapped around her stomach. Literally, the scar tissue wrapped around her stomach. It was choking her stomach. She couldn't drink, she couldn't eat, she couldn't hold even her own bodily fluids down. Vomiting, where the point where they had to run and do an emergency surgery to cut out that damaged part that was wrapped around. That's a real thing.
It is a real,
right?
Absolutely. It's a real thing. And then every time you're going to fix it, the trauma and trigger causes more. So there's no winning. It's like putting gasoline on a house fire. You keep chasing it and it never gets better. So once adhesions are formed or scar tissue is formed, It is
Well, what's the
forever.
difference between adhesions and scar tissue? Because some people may not know the
Sure.
difference because you're throwing those terms
Yes.
around.
So adhesions is the medical word for scar tissue.
Mm-hmm.
So scar tissue is called adhesions in medical language. And adhesions and scar tissue are the ones which are inside the abdomen, inside the body,
The
not the
internal
outside.
scars.
Yes. Yeah.
Right.
The one
And
outside
they're
is
sticky. They're sticky. That's why it's called adhesions, because it adheres to other organs, other things, because they have this very, like you said, a web-like, very
yes.
sticky things that get stuck to different organs, right?
Yes. Yep. So the scar tissue is, like I say, it's like a Halloween haunted house with webs, thick cords. It goes between the stomach and the liver, and the stomach and the spleen, and then a stomach and the peritoneum, which is the lining of the abdomen, the inside. And when you open it up, it's almost like a Velcro. You know, sometimes when you get a
Velcro.
and you
Yes.
and you
Yes.
that just the way you see the fiber standing up, you know, of the piece of cloth, which is not Velcro.
Right.
You know, that's how it feels like. And I've seen so many pictures when my surgical colleagues go in and they cut the adhesions. It's a nightmare because
I want to check in with everybody real quick. Anybody, because I want to know, because I know so many people have had any kind of abdominal surgery. If you've had any kind of abdominal surgery, I just want you to say, you know, a wave or whatever up in the comments, because I know that this is a very relevant conversation. All right. So I just want to check in with you guys to see if this is something that exactly. People sitting there waves. Exactly. So the next thing I wanted to just confirm, anytime you've had any form of abdominal surgery, you are now at risk for the rest of your life for possible complications.
Yes.
Did you guys hear that? Yes. Yes. Not making it up. Okay.
It's a strong yes.
Yes. Because it can be, somebody said, oh, I'm post-op, I'm wonderful. Somebody said, oh, I had a myomectomy, you know, they removed fibroids and I'm fibroid free now and I feel great and I'm wonderful. And I did my 3-month post-op and the doctor said everything looked good. Does that mean 3 months later, a year later, the next week, you could develop an obstruction? Are you still at risk, doctor?
So these adhesions normally, or the scar tissue normally forms years after. So it's years. It's when you forgot about it. So most acutely means you just had the surgery. If you have pain and discomfort, it's mostly some type of injury at the surgical site, some type of a staple leak, or there's a complication or abscess or pus collection, things which are related to surgery that happened, surgery failing. But scar tissue is body's response. That's the best way to say it. It's body's response of telling you, I am angry because somebody put a needle in me. It's body just fighting back and healing.
It's true. It's true. Okay, so please share your thoughts on the next thing I want to ask you is, why is this not widely talked about in ways that people will understand the profound risk? I know that they say, oh yeah, and there's a risk of scar tissue, blah, blah, blah. But like when you're in the middle of that, and I understand there's the consent forms that you sign when you're about to go into the surgery, but I'm talking about when you're in the consult doctor's office, right? Why is this not, I mean, I never, ever, ever heard anyone tell me, now understand that after you have the surgery, you're going to have a lifetime of managing the impact of scar tissue. Not one person, Dr. Raj.
You know, there's a barrier, there's a barrier to education which needs to be bridged. And that's why I feel patients who are, more educated and empowered, they should ask those questions. But here's the deal. Let's be very blunt here. It is an inherent risk. It's like when you go driving, there's risk of getting hit by a drunk driver, right? It's when you go surgery, you know there's risk of adhesions. And even if the surgeon was to tell you this.
No, they don't. They don't know what an adhesion is, though. You're saying that's like saying, oh, you know that there's a risk, but they don't know what that means.
Yeah.
That's like, come on. That's my whole point. Did y'all know what that meant? Somebody said they never, ever heard, just like me. They never heard, okay, you hear the word, there's a risk of adhesions, but what does that mean? That means, again, nobody said that means that for the rest of your life, you're going to need to manage around the care of helping your body to prevent. And the other thing is, I had a doctor going in on the comments with me, there's no way to prevent. I was like, I bet you don't even know the impact of nutrition and herbs. Don't act like that. Don't tell me this. Okay. So, so your answer was, really, you didn't give me an answer.
No, it's a tough topic because it's a known complication, and I do agree that we need to talk about it more. And
I get it.
I come
in an emergency surgery.
Yeah,
I understand when they're like, I need your consent, but I'm saying when you're in the office, I talk to women who are thinking about getting fibroid surgeries all the time, and they're having consultations. And the conversation I have with them is, okay, I need you to understand what this will mean in terms of what you have to manage around. Okay. And I'm not there. Listen, sometimes you have to choose the surgery because it is the thing that's going to save your life in the moment. You see what I'm saying? Yeah. Like it's not, you have to be alive in order to work to prevent in the future. Yeah. Right. Yeah. But the biggest thing is in those conversations, that's not the focus.
Yes. So, that's where I think the surgical planning comes into play. Like how emergent is the surgery, right? If it's Crohn's disease with abscess and blockages, or if it's a gunshot trauma, or it's a car accident where it got spilled out, in that case, the trauma surgeon will have to go in and act on it. So, during that time, the conversation is about saving the life, because if you don't put the gut back in, you lose the gut, you're done. Right. You're done. Right. So at the time, in terms of emergencies, I'm sure it's part of the consent form, but the focus is different. Yeah. They're just trying to save your life. But I do agree that when surgeries which are elective, say fibroid surgeries or elective hysterectomies or tummy tucks or any other surgeries which are elective, I do feel that we all can do a better job at staying informed of the risk of adhesions and also taking steps to minimize adhesions. Yes. So that's where your your campaign of nutrition and wellness is very helpful, because there's some people who make more scars than others. Period.
Exactly.
Yeah. It's a known fact. It's a known fact. Especially in African Americans, they make more scars than other races. Especially when it comes to keloid, it's an abnormal growth of scar tissue, and it's mostly in African Americans. So your race, your genetics has a big role in how much you will scar. So that's why
I have to say, I think it's connected to, again, because I always question this, is race the factor, or is it the health inequities that cause you to be more disproportionately affected, which is really more of racism, right? So I always question this, because I understand it plays more of a role than people own up to, right? Well, it's a reality we have to actually factor in, is the bottom line, right? So the answer is, we're not getting the information in the consultations. We have to get informed. That's why I'm literally on a soapbox about this. I'm not going to stop. I'm not going to stop, because I know we're not getting this information. And then when it comes to women, women are more at risk of obstruction when they're having uterus surgery, because everything is so tight. Here. It's so connected. Everything is so jam-packed in this area. Correct. Right?
Correct. Absolutely. Yeah, the pelvis is very small. It's very impressive what women carry in the pelvis. The uterus, the ovaries, fallopian tubes, rectum, bladder, urethra, and it's so tight. So when you have adhesions in the pelvis, or let me just make it simple, scar tissue in the pelvis, it's tough to operate, because the surgeon's tools are tough to go down, because pelvis is like a cavity. It's a valley. So it's like working in a valley with cranes, which is very tight. Mm-hmm. There's risk of injuries, because there could be injury to the bladder, which is the urinary bladder, the ureters, the kidneys, the small bowel. So because of the crowdiness of the pelvis, it's more risky. So that's why anybody who has had pelvic surgery, and also, Jesse, one thing also is pelvic radiation. Radiation is also a risk factor for scar tissue formation.
Yeah. Wow. So that's really important. Hysterectomies. I mean, women have that even more risk because of the fact that how tight everything is there. Correct. So when you're cut, it's a very tight area and it's already connected. It's like, that's why if you have fibroid, it can be pressing on the bladder. It can cause you to urinate all the time because of that.
Correct.
It can be pressing on the kidneys, so it can cause hydronephrosis, where your kidneys are become inflamed, like because of how tight everything is in that
Correct.
area. That's something very important to understand. The other thing is, the other question I wanted to ask you, I'm just going back to my questions here. So what I didn't get into in the conversation, which you started to talk about, was how scar tissue can overgrow radically, right? And let me be clear, we're not talking about, you know, and I think you used the term, it was abnormal scar tissue proliferation, which you talked about earlier, right? I call it, you know, overgrowth, radical overgrowth of scar tissue,
Right.
just so people can understand it. And that overgrowth can happen, it can be influenced by different things, right? Which, so that for us, I told you how we created our prevention kit because of that, to tackle hormonal imbalance, which can cause inflammation, right? Hormonal imbalance. Inflammation also can be chronic inflammation itself, as well as, you know, vitamin D deficiency, which affects immunity, but also vitamin D deficiency in research recently has been shown how it's actually very effective, impact associated with inflammation, as well as tumor, as well as stress regulation. Okay, so let's talk about that.
Sure.
What are the factors that can cause it to grow?
Sure.
Those things that I listed, how can they impact? And
Sure.
my thing, our plan is, we can affect prevention by now affecting those three, I call them like levers, right? If I now can impact my body's response to these levers, I can help the body to prevent, right?
Absolutely. That's a great question. It's a loaded gun. So I'm gonna take my time and answer
Yes,
everything.
take your time, please.
But
yes.
What you just asked is the root cause of the problem, right? It's
Yes.
the root cause.
Yes.
Once we understand the root cause, then we can chip away at the causes. And when you remove the cause, things get better.
Yes.
So everything in the body comes down to inflammation. That's it. The root of all evil, all disease is inflammation.
Yep.
Inflammation causes cancer.
Yep.
Inflammation causes scarring.
Yep.
Inflammation causes immune system to go crazy.
Yep.
Inflammation causes allergies. And it's a casket. It's like a dog chasing its tail.
Yeah.
Once it sets down that path, it avalanches down and it continues to reinforce a problem.
Yeah.
So let's talk about the scar tissue now, okay? So when you have surgery and the surgeons go in and they cut the organs or the peritoneum or the layers, that trauma triggers inflammation at the area because
right.
the tissue is cut. When the tissue is cut, body sends white cells, WBCs, which are your neutrophils, eosinophils, lymphocytes, basophils, and also platelets, which are blood products too. They, at the site of the injury, they respond as if there's a fire. Okay.
Yeah. They're coming in for repair. They're coming in for repair.
Exactly. So they use their memory in the DNA to repair. So for repair, what you have to do is you have to secrete chemicals that will attract the fibroblast, which is the cell that causes scar tissue, right? So now
wow.
it's almost like you are. It's almost like calling the cops, right? It's like 911. You know, you cut 911. What's your emergency? We need a fibroblast right here in pelvis, zip code 47802. Boom. Okay. And now, as these cells are there, they try to secrete these chemicals to invite the fibroblast and the cells to come and do the repair. And they start laying the collagen and things like that. And these cells also have memory too. So there's a type of lymphocyte that's called memory lymphocyte. So if the lymphocytes see this as an attack on the body, because cutting is an attack on the body. The lymphocytes have memory. Oh my God, there's an attack. So they continue having memory of this, and they keep making more chemicals or the memory, and that keeps inviting the cops, aka the fibroblast, to the area, keeps laying down the scar tissue. And after a while, body just loses its intelligence in the area and thinks there's chronic inflammation. And that keeps attracting the fibroblast, and they keep making scar and again and more scar. Now it also comes down to your genetics. You know, if you are African American versus Indian, Chinese, Caucasian, depending on the genetic risk factors, you will scar more. So, like I said, African Americans do scar more than others.
Variations in the gene? You say because of variations in the gene?
Yep, there's factor, but there's family history too. If you have a family history of adhesions, no matter what race you are, you're gonna have higher risk. So now you compound that, and on top of that, if somebody's a smoker, they, alcohol, drugs, chronic stress, just angry, can't sleep, and the hormones are, in an array, and they're like, oh my God, what do I do?
Estrogenic diet. If you have a diet that is highly estrogenic.
Yep. Or processed foods, red meat, all these things will create a physiological stress on the body. And also,
so wait, so I make sure they're catching everything you're saying. So you said now, so the body, first step is you had the surgery, and now your body went through the first 911. This is an emergency, red alert. Call in the fibroblasts because we need repair, right?
Yes.
Okay, so that's phase one. Now your body's going through that, but then it's still happening. It's still happening maybe because, of course, your body is healing, right? But then maybe it's still happening because you have a genetic history of making a lot of scar tissue, right? Or maybe you have a diet or chronic stress that causes you to basically, stress is an upregulator, right? So that means that, what that means is whatever you add stress to, it multiplies the impact, right? That's a good way of saying it, right?
Yep.
So basically it's like, if I had this much, I add stress to it, it's like, it makes it that much more, right?
It's
so
adding gasoline to the fire.
Gasoline to the fire. So you add chronic stress, you add a toxic diet, right? Toxic diet can now, again, do the same thing, add fuel to that fire, right? That creates more inflammation. So now this is after the surgery. This is just your body now post-surgery. This is what's happening. You're saying these influences, the chronic stress, the bad diet, right? The things that cause inflammation, right? The hormonal balance I talked about earlier. So I want to make sure that's where we are, right? Okay, go ahead.
Yes. And then the fibroblasts, let's call them the cops, right? So fibroblasts, they will invite more fibroblasts too. So they'll be like, guys, I can't do this alone. I need more fibroblasts. So now the fibroblasts themselves, yes, guys, we got the situation. So now they're gonna call in the SWAT team. So now more guys are coming in, and they're all making scar together. And that's when people make thick adhesions, when the fibroblasts don't have the memory and the intelligence to stop. Because what makes the fibroblasts stop is, again, body's own intelligence that, okay, I have enough scar here. But sometimes it goes overboard, and then it keeps making scar. And if you have low vitamin D, you have low antioxidants in your diet, right? You're not eating enough turmeric or vitamin D or
anti-inflammatories, right?
That will again cause more injury, and that causes more scar tissue.
So if you have so let's say, you know what, I've had my surgery, 3 months, I've had my 3-month post-op, things are looking good, right? And I want to say, let's just sidebar here. When doctors say things are looking good, are they actually doing a scan and looking at the scar tissue internally, or are they just looking at it externally?
They're looking on the outside only. There's no way to find adhesions with any scan. The best one,
So that is so important, because somebody asked me that in the comments. So I was wrong. I thought you could see it with a sonogram, so there's no way. Well, how do they? So they have to cut you open to see?
Correct. The only way.
Do y'all hear that? Do y'all hear that? Red alert. This is really important.
Yeah.
Okay. Which is why even more we have to be on the prevention tip, no matter what. Like we have to be on the prevention tip. Let me calm myself down so I don't cause no chronic inflammation going on with me right now. We have to be on a prevention protocol right away, because they look at it externally. They cannot see. There's no scan. I want you to say that again. There's no scan and no way of seeing scar tissue.
Correct. That is correct. There's
So after my second myomectomy, I had and it could be, I know why now. I'm going to just say it out loud. The surgeon who did my second myomectomy said, you're going to have to do IVF in order to conceive because there's scarring all over your fallopian tubes. Okay. So the only way he knew this is because he had just done my second myomectomy. You're saying he didn't know this because of any scan.
That's correct. Because we already assume that once we do surgery on the pelvis or anywhere, there will be scar tissue. It's a known entity. So we
But
kind
he
of
said
know.
there was a whole bunch of surgery from the first surgery because he said I never want to open you up again. The scar tissue was a nightmare.
Exactly. And it's very dangerous. It's the only way to see scar tissue is to do laparoscopy. Basically put a camera inside your abdomen, look around. And
so do y'all hear that? That is so important. Okay, so going back three 3-month post-op, they're examining you. They're only looking at the scar, making sure there's no oozing, it's healing well. That's what they mean when they say your scar looks good.
Yep, they're looking at the outside only. They're not looking for adhesions because at 3 months there will be no adhesions.
That's what you just did. Okay, that's what just happened. So even more, we have to take matters into our own hands in terms of making sure we're doing everything to prevent. All right, so then after that, 5 months, 5 years down the line, let's say you're going through a divorce, or you had a loss in the family, you're eating like crazy, you have a job that's stressing you out. What can happen to that scar tissue?
So stress does cause scarring, and I've seen that. Because stress raises the level of free radicals in the body, causes inflammation, and it could make scar worse. This is my thinking, that anytime you have inflammation in the body, especially chronic inflammation means you have a slow and simmering fire in your body. It's just simmering and smoldering, and inflammation causes pain, and inflammation causes scarring and injury. So I do believe strongly that anything which will raise body's inflammation levels, such as stress, poor diet, mental trauma. Mental health is huge. We know that people with depression, they have more heart disease. We know it's a known factor. So I strongly believe the mental health does affect your stress level and your healing. So if you're stressed out, you're depressed, and like I said, you have a bad marriage, abusive relationship, all those things will cause an area where you're not healing properly. Making too much scar is also a sign of poor healing. Because when you make scar, body also absorbs some scar to give it a balance. But if body says, I'm so stressed out, my immune system can't work on this because of the stress I'm dealing with and the chemicals in the blood from stress, I can't deal with the scar anymore. So then you start scarring more. You get chronic pain in the belly, in the back, and all over.
So, okay. So it's like this cycle. So we have to interrupt that cycle.
Yes.
Right?
Mind, body, soul.
We have to interrupt that cycle and say, okay, first of all, we need an anti-inflammatory lifestyle.
Correct. Bingo. Spot on.
Anti-inflammatory lifestyle.
That's it.
And so again, so do you understand what we're talking about here? It's like it is something we have actual power there. We have power to now, through an anti-inflammatory lifestyle that includes the stress management, that includes the foods, that includes, we say supplement to prevent. It includes the supplements that you take as part of a lifestyle. Because I think when I ask people, okay, you've had the surgery, what are you doing to prevent further complications? They just say, I didn't know I had to do anything. And that for me is the danger, that they're not being told, okay, you know what? It's very important for you to embrace an anti-inflammatory lifestyle and practices, right? That are going to now help your body create an anti-inflammatory environment, right? Because where there's more inflammation, it creates what you called about that abnormal tissue proliferation. It's like that abnormal tissue, which is the scar tissue overgrowing radically, because there's a reason. The scar tissue was fine 1 minute. It was fine for the first year, 2 years, 5, 10 years, the 10th year, out of nowhere, things were going crazy in your life. And all of a sudden, this is what's happening. There's a deep connection. There's a deep connection that we have the power to change. It's so important. It's so important that so I see some questions and I want to address them. People ask, like, the first thing that for me, when I notice that things are slowing, right? This is why pain medication, it's very important. Pain medication can slow your bowels.
Yes.
Anything that slows your bowels makes you more at risk of obstruction because things are not moving, right? In terms of not from scarring, but not scarring obstruction, because obstruction can also happen by virtue of your bowels just getting stuck, right?
Correct. Absolutely. Yes.
When it comes to scarring, though, I know for me, one of the biggest things was like, if I start, is the passage of gas is your body's way of saying things are working.
Yep.
Like,
or they're starting to work, you know?
Yeah.
Gas first.
Gas first.
It's a
right?
thunder before the rain.
Thunder before the rain. Exactly. So somebody says, can the scarring cause constipation? Can you answer that question?
If there's a lot of scar tissue and your colon or your small bowel is stuck in it, then yes, it can. And especially there could be, severe obstruction where it's just cutting everything off, or if there's a gentle squeeze on the colon or the small bowel and things are partially blocked, yes, it is possible. So the short answer is yes.
Yes, yes. And that can be a sign. Like, one of the evidences is, I remember after my second surgery that I was going to the bathroom fine. I was home 10 days from post-op, right? And I noticed I wasn't passing gas like normal. Like, I was starting to feel bloated.
Mm-hmm.
Like it was just building up, right? Then I noticed I was going to the bathroom less, right? And then that was the second phase. The third phase is I started vomiting, right?
Mm-hmm.
And then I couldn't keep down water. I couldn't keep
Mm-hmm.
down anything. Like, it was nonstop. Then they, put me on the NG tube, where they put this tube that's the size of your pinky up your nose, down your throat, while you're awake. Up your nose, down your throat,
we have to do it sometimes.
into your stomach, in order to, you explain what that tube does.
So thank you. Yeah. So just imagine for a second, you have a balloon full of water. Our gut's like a balloon. You can fill this with air or water. And the more the balloon swells up, the more pain and discomfort you feel. And you feel the nausea because your stomach and your small bowel is just getting swollen. So with the tube, imagine adding a straw to the balloon, and the straw just sucks out.
That's what
everything
it does.
is out. So that decompression
Yeah.
makes you feel better.
Yeah.
And the decompression makes your gut rest and make you rest.
Yeah.
Because the more relaxed you are, the better you're going to feel and you're going to heal faster. So we actually do tubes down the nose and also up the rectum too, to decompress on both sides. And this way the gut is flat and you feel better. Because if you're vomiting, sometimes if you vomit too much, you can rip your esophagus. Yeah. You can have a tear. Yeah. So
and they did it initially to see if the bowel would repair on its own.
Correct.
Without surgery.
Correct.
Because if they let the bowel, because your body knows how to heal itself. If you let it rest, there were times initially early on, the first time it did start to resolve itself, because when the bowel was allowed to rest, it repaired, but sometimes it repairs, sometimes it doesn't. In my case, it started to repair and then it just didn't. And they had to cut out. So when should someone said, can you get a lot of scar tissue after gallbladder surgery?
Yes.
I had one 20 years ago, and my stomach now hurts in the same area I had it removed.
Yes. And yes. Yep. So if they're getting symptoms, then they should see their GI surgeon, and they can do something called a small bowel series, where they make you drink barium, and that goes through the small bowel. Mm-hmm. And if there's a scar tissue somewhere, they will see a little pinch. There's a little pinch on the small bowel. They can pick it up on X-ray. See, you cannot see the scar tissue directly with any imaging except laparoscopy, but you can have evidence which is not direct but indirect. You can see the effect of scar tissue, which mostly is it cut off. Like normally, if the gut's like this, they'll see a cut off like this. That something's cut off, and that's mostly scar tissue. Yes.
What's the test called?
It's called a small bowel follow through. or small bowel series. So
Small bowel
small
series.
bowel series.
Series.
We make the patient drink barium or gastrographin, some type of contrast.
Contrast.
It goes through the stomach. And then we take pictures of their stomach and the small bowel, see how things are moving.
You know, so it's interesting because I had them do, when they did a CT scan, they said we can see an ileus developing, right? What does that mean?
Sure.
Because then that said to them, well, there must be an obstruction.
Yes. So
they can't
when they say
see the scar tissue, but they can see that it's starting to narrow. Is that what you're
correct.
talking about?
Yes. So ileus means that your small bowel is getting swollen up. It's distending. And normally that happens when there's a blockage up, downstream. Means when there's blockage downstream, things upstream are looking up, and that's called, looking dilated, and that's called ileus. Now that could be either there's a tumor, there's obstruction downstream, and downstream could be in the colon, in the ileocecal area, and that causes that. So it means they have to be careful and see, okay, is this ileus something that needs surgery, or is it something we can just correct the electrolytes? Because sometimes you can have ileus when you have pancreatitis too, or if you have if you have chronic pain medicines, or if you have low potassium, low magnesium, low calcium.
Again, see, those are things that we can affect, right? We can affect. So making sure your labs are
absolutely.
So going to your GI. So the other thing I heard you say is scar tissue cannot be picked up on a scan of any kind. However, they can take a test called a small bowel series that helps them see where there are
a pinching.
There are alterations or differences in the bowel, a pinching that can indicate there may be a actual scar tissue there,
or some of the blockage. Correct.
But then they can do a CT scan in order to see if there's any form of obstruction. They can do a test, right?
Yes.
Can they see it? Can they see an obstruction with an X-ray?
It's not as good as CT or MRI. If you want to, with any type of obstruction, you really want to make sure you find the exact spot in the gut where that's blocked. So for that, you get a CT or MRI, and that will tell you the exact spot. If it's the jejunum, the ileum, the stomach, colon, where's the spot? This helps the surgeons narrow down their action plan, where if they know there's a blockage in the jejunum, which is the mid-gut, then they go there, and then they look for it, and then they, take care of it. If there's scar tissue there, a lot of times they just cut the scar tissue. Every time the surgeons go in, they always try not cut the gut, because we want to save the gut. And you always want to get rid of the bad guys, that's the adhesion. So they try to cut them, but with the caveat, no matter how much we cut them, they're like a bad penny. They will circle back.
So so that brings up an important point. So if you're in a place where there is a scar tissue, that is an emergent situation, not scar tissue, obstruction. That is an emergent situation where, prevention is something you always do, but you need intervention.
You need surgery,
right?
Yes.
You need a surgical intervention if there is an obstruction, because that can actually lead to cardiac arrest. It can, the thing with Lisa Marie Presley's case, they said that they learned later that the small bowel obstruction actually led to the cardiac arrest, right? In my case, that on the delivery table, when I was having my daughter, my heart stopped on the delivery table because they were having to deal with the adhesion, the obstruction with the small bowel, right? Can you talk about how that can happen?
Sure, absolutely. So anytime there's blockage of the small bowel or the colon, there's always a risk of perforation. Perforation means the gut develops a hole inside, and feces and the microbes from the gut that leak in the peritoneum, sending your body into a shutdown.
That's what happens.
Because the way body is designed is, even though our gut is inside the body, I'm going to tell you a little fact today. It's actually a very interesting fact. The human body actually folds on top of the gut. So during embryological development, the gut actually is outside the body. So so even now, the gut is outside the body. It's not inside. The body folds around it.
The body folds around the gut.
Yeah, but the gut's actually outside the body. It's like a pole. A body just wraps around it. So when that happens, when the gut perforates, the toxins, the chemicals, the poisons all spill into the peritoneum, and body's like, absolutely not. I'm not letting this poison,
It shuts down.
go everywhere else. I'm gonna shut it down. So the body sends the warriors, the WBCs, white cells, the platelets, all these things show up to clamp it down. But when that happens in response to the leakage and injury, the chemicals which are released by the white cells, they gives you fever, they give you pain, sepsis, and that can cause cardiac arrest,
See that?
and brain injury and shutdown. That's
So
how things go wrong.
that is what happened with Lisa Marie Presley.
That's correct.
So
Septic shock.
in my case, and this is what they said, they had to repair the bowel because they were trying to get to the baby without damaging the bowel, and there was a tear. My heart stopped. They said, we have to get the baby out right now. I told my husband to get out. Like, it was a crazy trauma situation, and they were like, get the baby out, because they also made to make sure the baby didn't get damaged by the tear, right? And that, all I knew is everything went black, and they had to now take me off of epidural, cut me open, get the baby out right away, and then repair the bowel, right? So again, this is why I said to people, this is nothing, we can't play with this. Like we can't wait until an obstruction happens. We have to be proactive with this scar tissue, like every day. Like, I'm keeping you in check. This is your meditative practices. This is being very, very clear on your boundaries with respect to toxic relationships. No place for chronic stress. No place for chronic and toxic diets. Making sure all the herbal supplements you're taking are supporting an anti-inflammatory lifestyle. Getting all the right nutrients. All of these things are very important. They were important before, but now you have something that is working against you in your body. You see what I'm saying? So someone asked specifically, and I want to. I know. God, I told you we were gonna get into.
I'm telling you, we can go on for like weeks at a time.
I know. Someone says, please talk about Crohn's. My son has problems with bowel movements because the whole bottom of the colon is very narrow. How do you fix this?
So, Crohn's is actually one of my specialties. And the way Crohn's develops is, it's an imbalance of the immune system, where immune system attacks the gut, and all the soldiers, the white cells, that come in and they just try, eat it up, and then the immune system loses its mind. I always call it loses mind. There's a fancy word, it's called immune modulation. Modulation means fine-tuning and just, painting with the paintbrush. But in Crohn's disease, immune system just works in clunks, doesn't think properly, and keeps attacking. So that causes scarring and fistulas and narrowing and stenosis. So in this case, without knowing too much history, if there is narrowing because of Crohn's disease, depending how bad the narrowing is, the first question is, does it need emergent surgery? Because if it perforates and the gut rips open, the kid's and the child's life is at risk, because they'll go to septic shock and body shutdown. Bad things happen. The goal is to avoid that. And if there's no emergency need for surgery, in that case, we have to cool down the inflammation, and there's medication for that. These days, there's injectables you can use, even though we're like, well, we don't want medications, but I've been doing this for 20 years now, and they're well. They do well.
There are certain medications that are needed for an urgent situation.
You have to put out the fire. See, if your house is on fire, you cannot worry about a bunch of sunflower and your daffodils. You got to take out the fire first, and then you can plant all the garden again. But right now, the question is it going to kill me? Is it going to kill my loved one? If that's the case, what is the fix for that? You got to put the fire out. When the fire is out, then you work on long-term prevention, then nutrition therapy, stress management, vitamins, minerals, and then also medications to keep the inflammation down. All comes down to, again, square one, inflammation. That's the reason of every disease in the body and known to mankind.
So someone asked, I want to have cosmetic surgery. How can I prevent scar tissue or minimize it? So very important, I'm going to say what I think, and then Doctor, you come in. Is the first question I would ask is your life, risking your life worth this? Okay. Absolutely. Because I wouldn't recommend any surgery unless it is necessary to save your life.
Right.
Okay. Because of all the risks that we just talked about. Scar tissue cannot be, like, your body has to create scar tissue. What we can help you prevent is the overgrowth, the radical, what did you call, abnormal tissue proliferation.
Right.
But still, even with that, your unique genetics may be like you are a wrangler and chasing and running and so far ahead, you know, like your unique situation. So if you don't have to put yourself in that situation, and I don't know what your situation, and I'm not judging you in any way, shape, or form, okay? I'm not. Some cosmetic surgery literally saves our mental health, and I don't know what that is for you, right? But I would say that take every preventive measure you can to, reduce the inflammation. That's why we created our prevention kit, to empower you to do that. And if you feel you need to, please, we definitely are here to help you and support you on your journey afterwards. But please know, everything that we've said, it's a lifetime of management around that.
Absolutely. No, very well said, Jesse. That's well said. Yeah, depending on the surgery, you have to pay attention to your health. Where do you stand? Almost 20 million Americans have anemia. 25 million people have vitamin D deficiency. You have to make sure that nutritionally your body's ready to heal properly. See, there's many ways to heal with scar tissue. One is proper, and then it's improper. If you have good balance of vitamins, minerals, and stress management and all, you will heal properly and adequately. And if you have risk factors, smoking and drugs and stress and other risk factors, then you will heal poorly. And by poor healing also means abnormal scar formation. So definitely, I think goes without saying, no matter what we do, what type of surgery it is, cosmetic, urgent, non-urgent, nutrition and the wellness 360 lifestyle is very important.
Yep.
That's the only thing that'll keep your physical and mental sanctity.
Absolutely.
Yeah.
Again, that's for us. And, and the ethos behind the creation of our prevention kit, Dr. Raj, is because we said, the first things, it's easier for people to supplement than change their nutrition lifestyle, right?
Yeah.
So you got to take a first step. I'm not saying instead of, you got to take a first step. So if I say, let's start you by taking these supplements.
Yeah.
Second step is let's make sure that your diet helps to support that as well. Because
Absolutely.
the dietary changes are a process. They're a chain of reaction. Like they take time, you know what I mean? And especially with certain people's, what their habits, their ethnic, traditional cultures, all those things that play a role, right? But I know that, okay, I can take a first step by changing the supplements I'm taking. So that for us was the ethos behind, okay, we're going to at least create this prevention kit so that you're tackling 3 things that disproportionately affect people of color: hormonal imbalance, inflammation, vitamin D deficiency, right? They
Absolutely.
disproportionately affect people of color, so that you can at least put yourself ahead of the game with respect to your prevention proactivity, right? And
Absolutely.
then someone asked, they said, I had fibroids removed and a C-section. I'm at higher risk.
Of scar tissue?
Yes.
Absolutely, yes.
Absolutely.
Yes. 100%. It's
100%.
like, yeah,
100%.
1,000%, I would say.
Exactly. I had an appendectomy, gallbladder removal, hysterectomy
Yes.
with 1 ovary removal.
Yes.
Absolutely. All of these.
Yes.
Okay, so I think we answered that question over and over. I'm trying to see what we'll close with, because I know we've been, this is way over. But
I want to add one more thing.
Yes, please.
If this was the, let's say, 1100 BC or 1100 AD, I still feel food was still good back then, more nutritious. In this day and age, even if you're eating chicken or you're eating a fruit,
Organic,
the nutrition value is nil. So I personally supplement all the time.
All the time.
I've been taking supplements since I was 5 years old. My father, God bless him, he would give me vitamins and minerals growing up, and it helped me a lot. And even now, not a day goes by when I don't take something. I use supplements for my hair too. As you know, I got good hair. Thank you very much. So I actually put almond oil in my hair, sunflower oil, coconut oil. I consume them too. I put supplements on my face too. I take probiotics. So you have to pay attention to your body. If
Yeah.
you think of your body like a temple, just think what a temple needs from maintenance. Body is
Yeah.
high maintenance, and supplements is the best way out.
Yeah.
Nutrition is great, but with the busy lifestyles we have, you
Yeah.
want to make sure that the supplements give you enough percentage of what you need.
Yeah.
Because you have to make sure at least you're taking 300 to 200% of what's needed.
Yeah.
Because when you take the supplement, half will go in the stool
That's
because
right.
body's absorbing depending on the body
200% of what you need. That's right.
So,
That's right.
yeah, so if you're taking a supplement that's only 25% of vitamin
Well, that's
A,
why I
good luck,
love
buddy.
the liquid drops that we do, because
Much better.
the liquid drops absorb a lot better
100%.
into your
100%
better
liquids
as well.
always better.
That's why we do that.
Absolutely. Liquids are the best.
Mm-hmm.
Because there's more surface area, because
Mm-hmm.
it's less work for the
Right.
body, and the molecules are ready to go. So it just goes across the small bowel into the liver, and from the liver sends it all over. So I want to give an education moment there. Supplements are not a oh my god supplement. It is necessary in this day and age. If you don't take supplements, you will not enjoy healthy aging. Especially as,
oh my God.
as all of us age, even though all of us look great right now, but as we go older, you want to build the reserves in the body.
I would love for you to share why, though, because you said 11 BC versus today. What? Because somebody may not have caught that. Why is that?
Sure. At the time there was no GMOs, right? There were no pesticides, no chemicals, no biotoxins. Mm-hmm. So right now, you're eating fish, and God knows where the fish is coming from. There's mercury in the fish, or somebody's antidepressants or pesticides. So now you're ingesting the fish, which is good for you, but there's toxins coming with it.
Yeah.
And those toxins will injure the gut lining and the body itself, causing cancer and disease. So back in the day, farming was more organic. So yeah. I know for a fact, I'm sure they did not have fancy strawberries and mousse cakes and things like that, but people were stronger back in the day. I mean, people are stronger, bigger, taller.
They live longer.
They walked all day.
Yeah. So see that is why it's really important. I know for us, the 3 P's of our company are it's personal experience. It was born out of the Detox Now was born out of me being a patient first, right? So it's personal experience, and it's people over profits. We make sure that we are providing all kinds of support services, free consultations, free support groups, and free resources in addition to those who, for those who may not be able to afford things that they are wanting to use later down the road. Maybe it's not in their budget right now. We make sure there's always something free available. And then the third thing is pure ingredients, organic as well, free of allergens, wild crafted. But even, because understand the foods, even if they're organic and all that, they're still coming from a soil that has been severely depleted, depleted. One of the things I say to people, part of holistic living has to be sustainability focused, right? That means we have to be thinking about minimizing plastics, minimizing, in terms of the waste, the use of waste. And unfortunately, we live in a world when I feel like I'm an alien as a tree hugger, they call me, right? Because I'm like, no. If somebody brought a plastic bag into this house, it's going to be used many times before it gets out of here. It's going to be used as a garbage bag. It's going to be used as this. It's going to be used as that, And I tell my grocer, I give him back the plastic bag. I say, use them again, right? Because I'm like, no, we're going to be doing a detox swap next month. So please tune in from what you had to what you can use to eliminate toxins from your environment. Because it's really important to understand, like, that's part of it. But again, that everybody sees that as hard, Dr. Raj. So I'm like, okay, let's start with the supplements. Yeah. Let's start with the supplements, please. Get your prevention kit. Yeah. That's step 1, all right? And let's at least take those steps daily. Start taking them daily so that we can take the steps to say, okay, you know what? Yeah. I'm going to get this scar tissue in a place that I'm not worried about it 5 years down the road because I'm affecting my lifestyle proactively, right? I'm going to start now. Hopefully, as you're taking the supplements, you're going to start being more, you're going to start implementing some of the practices that we teach, like medical Qigong, right? For meditation practices, or you're going to journal, or you're going to pray, and you're going to do all those things. But we're going to help support you as you come along as our community. We together do these things. We just want you to know you're not alone. But this was, I thank you. I called you today. I was like, I need a gut guru to speak on this because it was too triggering
Active
for me,
service.
Dr. Raj. It was too triggering for me. And I'm so grateful because I see this and I think people think that has nothing to do with me. And I'm like, no, you are at risk. Please, let's do something about it. And I think that was everything for me. So thank you.
Absolutely. You're welcome. It was such a pleasure, and maybe we'll do this more often.
Yeah, I like that.
Yeah, should be fun.
Follow Dr. Gut Happiness, please, if you don't already. You see he has a wealth of amazing information. And yes, we will definitely be bringing him back. Thank you, everybody.
Wonderful.
Thank you, doctor.
Thank you. Thank you, guys. Good night, or good
Appreciate
morning,
you.
good evening, depending where you're at.
No. Oh, yeah, well, we don't know where they're tuning in from.
Thanks. Bye.
All right, everybody. Thank you so much for joining us today. My goodness, I hope you learned. I learned so much. Scar tissue cannot be picked up on any kind of scan. We have the power to be proactive and help our bodies prevent complications such as small bowel obstructions by taking on preventive measures to help to prevent the scar tissue from growing radically. Okay, that's what I hope you walk away with. If you are dealing with any of these issues, please, you have more questions, please take advantage of our free consultations. We have free consultation options. My partner, Dr. Amun, does 10-minute free consultations on Fridays. We have free consultations on Mondays and Wednesdays. The link is thedetoxnow.com. You can take our quiz, and by taking our 3-minute quiz at thedetoxnow.com,